All right, welcome in everyone to our deep dive today. We're going to be talking all about arthritis,
Arthritis. Yeah.
but we're not just talking about, any old information on arthritis.
Right.
We're diving deep into this resource. It's called the Arthritis Information Tool, and it's from the National Initiative for Care of the Elderly in Canada.
Okay.
Now, you might be thinking, well, I'm not in Canada and I'm not elderly, but,
Yeah.
stick with us because this tool, it's really packed with insights that are valuable no matter where you live or, how old you are.
Absolutely.
Plus, did you know that there are over 100 different types of arthritis?
Wow. Over 100.
Yeah, it's crazy, right? So it's not just a getting older thing.
Yeah.
There's a lot more to it. So in this deep dive, we're going to really focus on the two main categories of arthritis. We've got osteoarthritis
Mm-hmm.
and inflammatory arthritis.
Yes.
And we really want to give you the knowledge, to navigate this whole landscape of arthritis.
That's so important because arthritis is a very broad term.
It is.
And having a good understanding of the specific type that you're dealing with is key to managing it effectively.
So let's start with the basics.
Okay.
What is arthritis?
Well, at its core, arthritis is inflammation of the joints.
Okay.
And this inflammation causes pain and stiffness.
Right.
And over time, it can actually damage the structure of the joint itself.
So it's more than just kind of those achy joints.
Right.
What makes osteoarthritis different from other types of arthritis?
Osteoarthritis is often called the wear and tear arthritis.
Okay.
You can think of it like the tread on your car tires
Okay.
over time, and with use, it wears down.
Yeah.
In osteoarthritis, the cartilage that cushions your joints gradually wears away, causing the bones to rub against each other.
Ouch, that sounds painful.
It can be, yes.
So I've heard that this type is really common, especially, like I said, later in life.
Yes, very common.
Is that true?
It is. Over 80% of adults over 55 have some degree of osteoarthritis. Many people might not even experience symptoms, but the wear and tear is still happening.
And it can affect any joint.
It can, but the most common areas are the hands, knees, hips, neck, and lower back.
Okay, so the workhorses of the body.
Exactly.
Makes sense that those be the ones to wear down first.
Yeah.
So if someone is dealing with osteoarthritis, what are some of the symptoms that they might experience?
Well, the classic signs are pain, stiffness, and swelling in the affected joint.
Okay.
You might also have a decreased range of motion, meaning difficulty bending or extending the joint like you normally would.
Right, right.
And in more advanced cases, you may even notice some deformity in the joint as that damage progresses.
So is there a way to reverse that damage?
Unfortunately, no.
Yeah.
Once the cartilage wears down, there's no way to regrow it. So the focus really shifts to managing those symptoms
Okay.
and slowing down the progression of the disease.
So no magic cure,
Not yet.
but there are things that people can do
Definitely.
to manage it. What are some of those approaches that work well?
Well, there's a range of options.
Yeah.
Simple over-the-counter pain relievers can be helpful,
Okay.
as can topical creams or ointments.
I see.
Low-impact exercise like swimming or cycling can also be really beneficial.
Oh, so you want to stay active.
Yes, gentle movement can actually reduce stiffness and pain over time.
I would think you'd want to rest it.
Rest is important, but so is movement. Think of it this way. If a door hinge isn't used regularly, it gets rusty and stiff.
Right. Yeah.
Same principle applies to our joints.
Oh, that's a great way to think about it.
Regular gentle movement helps keep them lubricated and functioning properly.
So what about other options like assistive devices or alternative therapies? Do those play a role?
Yeah, they can be valuable tools.
Okay.
Assistive devices, things like shoe inserts, braces, canes, or walkers can really help reduce the stress on those affected joints.
Mm-hmm.
And then you've got complementary therapies like acupuncture, massage, or Tai Chi.
Yeah.
These can help with pain, improve flexibility and balance, and enhance overall well-being.
So it sounds like it's about finding what works for each person.
Exactly. It's very individualized.
Finding the right combination.
Yeah.
What about lifestyle changes? Are there certain lifestyle changes that can help with osteoarthritis?
Absolutely. Maintaining a healthy weight and getting regular exercise have a huge impact.
Oh, I see.
These changes can reduce stress on your joints, strengthen the surrounding muscles, and improve your overall joint health.
So basically, things that we should all be doing anyway.
You got it. Taking care of your joints is part of taking care of your overall health.
Before we move on to inflammatory arthritis, you mentioned relaxation and coping skills.
Yeah.
How do those play a role in managing osteoarthritis?
Living with chronic pain can be incredibly stressful,
Yeah, I bet.
both physically and emotionally.
I can imagine.
And stress can actually worsen pain, make it even harder to manage.
Oh, wow.
So incorporating relaxation techniques and healthy coping mechanisms into your routine is really vital.
So it's about empowering yourself,
Take
having
this.
that sense of control over the condition.
Yes, and improving your quality of life.
So we talked about the wear and tear type of arthritis, osteoarthritis.
Right.
Let's move on to that second category. What about inflammatory arthritis?
Okay.
How is this category different?
So inflammatory arthritis is characterized by inflammation, as the name suggests.
Okay.
But the cause is different. It's not just wear and tear.
Right.
In this case, your immune system actually mistakenly attacks the tissues in your joints.
Oh, wow. So your body's attacking itself.
In a way, yes.
Why would that happen?
That's a great question, and that's something that researchers are still trying to figure out fully.
Oh, wow.
The exact cause of this immune system malfunction.
Right.
Still not fully understood. But we do know that genetics, environmental factors, and even hormonal changes can all play a role.
So it's complicated.
It is, yeah, a complex interplay of factors.
So you also mentioned that most forms of inflammatory arthritis are considered autoimmune diseases.
That's right.
What does that mean exactly?
Autoimmune diseases happen when the immune system, which is supposed to protect us from foreign invaders like bacteria and viruses,
Right.
it mistakenly attacks the body's own healthy tissues.
Oh, wow.
And in the case of inflammatory arthritis, the immune system is targeting the joints, leading to that chronic inflammation and damage.
And what are the consequences of that?
The consequences can be pretty serious.
Oh, no.
Besides the pain and stiffness,
Right.
inflammatory arthritis can also cause fatigue, limited mobility, and even damage to other organs in the body.
Wow, that's a lot.
And one of the most concerning aspects is that the joint damage, it's irreversible.
Oh, so that makes early diagnosis and treatment really important then.
Absolutely. The sooner you can identify the specific type of inflammatory arthritis and start appropriate treatment,
Okay.
the better your chances of slowing down the progression of the disease and preventing further damage.
So are there different types of inflammatory arthritis?
Yes, there are, each with its own characteristics and challenges. Some of the most common types include rheumatoid arthritis, ankylosing spondylitis, lupus, gout, and psoriatic arthritis.
Okay, so how do doctors determine which type someone has?
It can be a bit of a detective process.
I see.
We rely on a combination of factors, including your medical history, a physical exam, and tests like blood work and x-rays.
Okay.
These tools help to pinpoint the type of inflammatory arthritis and rule out other conditions that might be causing similar symptoms.
So once a diagnosis is made, what are the treatment options for inflammatory arthritis?
Well, medications are often a cornerstone of treatment for inflammatory arthritis.
Okay.
They work by suppressing the overactive immune system,
Right.
reducing inflammation, and slowing down joint damage. But the medications can be quite complex with potential side effects and interactions.
That does sound a little overwhelming.
It can be.
What advice do you have for someone trying to navigate that world of medications?
My advice, be proactive. Don't be afraid to ask your doctor lots of questions.
No.
Make sure you understand how the medication works, the potential side effects,
Right.
any lifestyle modifications you might need to make while taking it.
I see.
It's a partnership between you and your healthcare team to find the right treatment plan.
Absolutely. That makes a lot of sense.
Yeah.
Are there any good resources that you recommend for learning more about these different medications?
Yeah, the Arthritis Society Canada has a fantastic website with a wealth of information.
Great.
It even has a comprehensive guide on the different medications used to treat inflammatory arthritis.
Perfect. And we'll include a link to that in the show notes for everyone listening.
Great.
Now, are there other things that people can do to manage those inflammatory arthritis symptoms aside from medication?
Yes, absolutely. While medication plays a critical role in controlling the disease process, lifestyle adjustments are equally important.
Okay.
Things like diet, exercise, sleep, and stress management all contribute to managing inflammation and improving overall health.
Can you give some specifics on how those lifestyle factors make a difference?
Sure. Let's start with diet.
Okay.
Research suggests that certain foods can either trigger or reduce inflammation in the body.
Oh, interesting.
A diet rich in fruits, vegetables, and omega-3 fatty acids can help dampen inflammation.
Oh,
Whereas processed foods, sugary drinks, and saturated fats tend to worsen inflammation.
so it's not just about what you eat, it's about what you don't eat.
Exactly.
What about exercise? Would you recommend that for someone with inflammatory arthritis?
I would, yeah. Exercise is crucial, even with inflammatory arthritis.
Okay.
I know it can seem counterintuitive when your joints are painful and stiff,
Right. Yeah.
but regular, gentle exercise can help reduce pain, improve flexibility,
Oh, wow.
strengthen the muscles that support your joints, and even boost your mood.
So what kind of exercise would be best?
Low-impact activities are usually well tolerated,
Okay,
like swimming, walking, cycling, and Tai Chi.
got it.
It's important to find activities you enjoy and that don't put too much stress on your joints.
Makes sense.
And start slowly. Gradually increase your activity level.
So listen to your body.
Always.
You mentioned sleep and stress management as well.
Yeah.
How do those fit into the picture?
Both sleep and stress have a big impact on inflammation.
Oh, okay.
When you're sleep deprived
Right.
or chronically stressed,
Okay.
your body produces more of those inflammatory chemicals, which can make your arthritis symptoms worse.
So those are really important to keep in mind
They are.
and to manage.
Yes, prioritizing good sleep and incorporating stress-reducing practices into your routine can make a big difference.
It sounds like managing inflammatory arthritis is a very multifaceted approach.
It is. It's about addressing all the factors: physical, emotional, and lifestyle.
Okay.
It's a journey of self-discovery and finding what works best for you as an individual.
So we've talked about osteoarthritis, the wear and tear type,
Mhm.
and inflammatory arthritis.
Yeah.
Can we take a step back and just recap the key differences between these two main categories?
Absolutely.
Yeah.
Osteoarthritis is all about that mechanical wear and tear on the joints. That cartilage cushioning the bones gradually breaks down.
Okay.
It's often associated with aging and repetitive use.
Got it. And inflammatory arthritis is the one where the immune system attacks the joints.
Right, causing that chronic inflammation to irreversible damage.
And even though both types can cause pain, stiffness, and mobility issues,
Yeah,
the underlying causes are totally different.
completely different.
And so the treatment strategies are also very different.
They are.
It's like comparing apples and oranges.
I love that analogy. And it highlights why seeing a healthcare professional is so important if you're having any joint issues.
That's a great point.
They can determine the root cause
Okay.
and guide you toward the best treatment options for you.
Now that we all have a better understanding of these deep dive,
It has.
thank you so much for joining us today and sharing all your knowledge.
It was my pleasure.
We've covered so much from understanding those different types of arthritis to really taking that proactive approach to joint health.
It's been great.
It has. It really has. And we hope everyone listening feels empowered to take charge of their joint health.
I hope so too.
So to wrap things up,
Okay.
remember, knowledge is power. And taking care of your joints is a crucial part of living a healthy, active life.
Couldn't agree more.
So that's it for today's deep dive. Thank you all for joining us. We'll see you next time.
Bye, everyone.